In this video, I'll be caring for a patient with oxygen problem. First, I want to perform hand hygiene, identify my patient, and introduce myself. Identify my patient allergies, if any, and teach my patient about the procedure and duration. If I walk into my patient room, I want to set them up in a prone or sitting position. I want to set my patient up in a sitting or half-hour position and do physical assessment on my patient, checking the pulse rate and the breathing. I may also want to use pulse oximetry sensor to check my patient oxygen saturation. So I will use a pulse oximetry sensor on my patient fingers, toes, or ear. If I get an oxygen concentration that is 95% or up to 100, that's normal. If it is anything less than 95, it's not normal. Next, I will talk about the three supplemental oxygen delivery devices. The first one is nasal cannula, which is the simpler and most tolerated supplemental oxygen delivery device. I will connect my nasal cannula to the oxygen setup in a room, adjust the flow rate to the prescribed rate, check the pumps to make sure that it is delivering adequate oxygen, place the pump in the patient's nostril, place the tubing behind the patient's ears, perform hand hygiene, and document. Next, the simple face mask, which deliver higher concentration of oxygen compared to the nasal cannula, and it is used for patients who can breathe by themselves but need help with supplemental oxygen. I will connect my simple face mask to the oxygen setup in a room, adjust the flow rate to the prescribed rate, make sure that my mask is delivering adequate oxygen flow, place my mask to my patient's face, covering the nose and the mouth, and the scrap behind the ear. I will perform hand hygiene and document. Next, I want to talk about my non-rebreather face mask, which deliver higher concentration of oxygen compared to the simple face mask and the nasal cannula, and it is appropriate for patients who need higher concentration of oxygen. I will connect my non-rebreather mask to the oxygen setup in a room. I will adjust the flow rate to the appropriate flow rate prescribed, and I will inflate the reservoir bed, and I will make sure that the mask is delivering adequate oxygen, and I will place it on my patient's face, covering the nose and the mouth and the scalp behind my patient's head. And it is important to inflate the reservoir bed, one, because it can be inflated with pure oxygen, which along with the oxygen from the oxygen source provide close to or about 100% oxygen concentration. If it is deflated, which is the bar one, and that's the most important reason why we should inflate it, is if it is deflated, it will produce or make our patient to inhale carbon dioxide, which we don't want because of its devastating effect it might have on the patient. I will perform hand hygiene and document. Next, I want to talk about the incentive spirometer, which is used for post-operative patient, and it is mainly used to exercise the lungs. First, I want to set my patient up in a half-hour position and adjust my volume to the predetermined setup. Next, I will have my patient breathe out normally, and I will have my patient place the mouthpiece in their mouth. I will have my patient take in slow and deep breath, raising the patient to the predetermined level, and I will have my patient hold their breath for 2 to 6 seconds. Next, I will have my patient remove the mouthpiece from their mouth and breathe out, and I will have my patient to cough. If my patient have any incision or operation in the abdominal area, I will have them place a pillow or a blanket, something that soft but will provide pressure, a little bit of pressure for them to cough. And I will perform hand hygiene and document. And I will make sure that I will provide patient safety and throughout my procedure. Thank you.